If you've got GBS, then the recommendation is to go into hospital once your waters break, so that we can administer IV antibiotics every 4 hours while you're in labour, if that's what you're accepting. That will be done via a cannula. And GBS OBS will also be offered and done to baby once baby's been born, so that we can look for any signs of GBS infection. If you don't make it in time, like it might be your fourth baby and you have a really, really precipitant labour and birth, and you don't get any IV antibiotics in before you've delivered your baby, before you've birthed your baby, then we'll still just do observations on the baby anyway. And the peds will decide if, we'll offer prophylactic antibiotics if there's any signs of an infection. So a lot of women really worry about not getting in on time or not getting the antibiotics while they're in labour. But what happens if you have a baby quickly, or what happens if you don't know that you've got GBS? Then we'll do obs on baby. If someone doesn't know they've got GBS, then when we do babies checks, if we notice any recessive breathing, any nasal flaring, or any grunting, a high temperature, anything like that, any signs of infections, then the baby will get a full septic screen anyway. So it is ideal and recommended that you go in quickly once you're in either established labour or if your waters go. But if you don't get in because you have a really quick labour and maybe birth on the way to hospital, or go to the toilet and have your baby, then there's not much we can do to stop that, is there? So in that case, baby will be checked after they've been born, and then we'll be looking for signs of infection postnatally. There's a great episode on GBS on the the Great Birth Rebellion. It's episode 6. I'd definitely recommend you checking it out.